What we have between Fargo and Sioux Falls is very high quality orthopedic surgeons with a lot of different areas of expertise, and it gives us the ability to give that broad educational experience to the residents that would train here. My name is Bruce Pyatt. I'm an orthopedic surgeon at Sanford, and because we're a new program, it means we haven't built in any old biases into our education of residents. So one of the other really unique things that we have in our residency program is that by having two high-quality sites between Sioux Falls, South Dakota, and Fargo, North Dakota, is that we've also looked at it to the point of trying to individualize the training that we give to our residents. So they will have significant exposure in Fargo during the early years of their residency. They will spend at a minimum 1 full year in Sioux Falls during their residency, which we will take care of and be responsible for. I think this part of the world has exposure for both somebody who is single and who is family-oriented. There's a different attitude about people that live here in the upper Midwest. It's great people who are hardworking, but you also have the exposure of these metropolitan areas that are big enough to give you all of the culture that you need and that you would want.
I envision somebody who doesn't want to live in a large city, doesn't want to do a lot of commuting to 5 or 6 different hospitals. I think that might be very appealing for a resident in that situation. My name is Robert Vandermark. I'm an orthopedic surgeon here in Sioux Falls.
So we're very committed at Sanford Health to doing high quality research. We're delving into the world of stem cell research, which is most people in orthopedics feel that that's really going to be a game changer in this world.
Well, I think we have a very strong program, I think both in Fargo and in Sioux Falls. I know in Sioux Falls we have Division I teams. We take care of South Dakota State and the University of South Dakota, Division II, Augustana University, and then we also have local high school teams we take care of. There's also the developmental league for the MBA team here in Sioux Falls, which we take care of.
Tremendous variety of opportunities for them. And as part of that, we can integrate our residents into the community by allowing them to be a team physician, where now they not only get the exposure to orthopedics, they now get exposure to coaches and athletes and families and everybody else in the region. What we're developing is a bioskills lab that gives residents the opportunity to practice on non-living humans, whether that be through virtual simulation techniques that are available and opportunities. We'll have ability for them to practice arthroscopic techniques of hip, knee, shoulder, all the joints that we work on in a virtual simulation model, so that we can not only let them practice it, but we can see how they're doing with it. Every student we talk to about that, their eyes light up immediately, because everybody's looking for that. Everybody needs that and wants that. Our plan is to move ahead with a orthopedic specialty type facility where we will have all of our services integrated into one building. So it gives us the opportunity to, in very close proximity, be able to have total patient care in mind at all times.
I think the advantage of this program is going to be, I think, the personal attention that the residents are going to get. And I think the other thing is going to be that's going to be an opportunity both to do research, both basic science and clinical. And I think once they're done, they'll be well trained to even do a general orthopedic practice or even go look for a fellowship. I think that's the goal of the program.